Today we're going to cover teratogens, which you can find in chapter 2, as well as some chapters in the future. What I wanted to talk about first was the critical periods of development. So you can see here when the embryo is first being formed, it's a zygote, then it becomes an embryo. There are critical periods during development in utero that have significant changes in or critical periods of that development of that feature. So, for example, when you say a doctor may say you can take Advil up until 20 weeks because at 20 weeks the kidneys are starting to be formed and there can be some abnormalities that happen if you take Advil during the formation of the kidneys. So there are things that you should not do during pregnancy or take or be exposed to. And that is what teratogens are. They're environmental factors that can contribute to birth defects. So it depends on timing, like I said, with the Advil at certain points. The number, so taking Advil maybe once might be okay, but maybe taking Advil several times a day is going to be worse. Exposure, so when we talk about maybe lead exposure, if you're exposed in high doses of lead, that's actually going to be worse, obviously. And then the genetics. So the genetic vulnerability, are you susceptible to certain things that somebody else might not be? So some specific teratogens, the first one we're going to talk about is alcohol. And this is actually one of the highest levels of exposure in prenatal development. The possible outcomes are cognitive and behavioral problems, fetal death, as well as fetal alcohol syndrome or FAS. There are some physical characteristics of a child that has FAS. You have some facial characteristics there, as well as the hands are usually more club. The fingers are flat. So there are some physical traits that you can see as well as some behavioral or cognitive traits. Tobacco is another one, and this includes anything, vaping, patch, gum, any of that, as well as secondhand smoke. So if somebody else in the household smokes, that is also a teratogen that the mother and the embryo is exposed to. So the possible outcomes for that is low birth weight or premature birth, or possibly even miscarriage. An ectopic pregnancy, and that's where the pregnancy is not viable, it's not in the uterus. Placenta previa, which means that the placenta is low and covers all of the cervix, which leads to a high chance of miscarriage. And then placenta abruption, and that's where the placenta separates from the uterine wall. There's also legal and illegal drugs. So I mentioned Advil, that is a drug, obviously. That's a over-the-counter medication. Then there's also some prescription medications. So obviously, if you are pregnant, you would want to discuss all of your medications with your OBGYN. It's difficult to know exactly what the illegal drugs are, what kind of effects they're going to have, because you don't know what else is happening, how often they're using the drugs, if it's laced with anything. So there's a lot of unknowns about that. But the outcomes of that are possibly brain damage, low birth weight, again, stillbirth, miscarriage. Pollutants we are also exposed to without knowing a lot of time, right? Lead, pesticides, mercury, radiation, BPA, all of those things we are exposed to on low doses throughout the day. And some people have a higher susceptibility and some people are exposed at a higher rate. So some of the possible outcomes are brain development, problems with brain development, learning problems, sensory impairment, and again, the miscarriage, premature birth, or low birth weight. Another one is toxoplasmosis, and that is why when you are pregnant, it is wise to have somebody else change the litter box if you have a litter box, if you have cats in the home, or if you have to change the litter box, you're the only one, put a mask and gloves on. It's also in raw meat and some dirt. There are also some diseases, sexually transmitted diseases. You can actually transmit the STD to the child at birth. You can also have a premature birth, miscarriage, stillbirth, ectopic pregnancy, which is why you are tested when you are pregnant. So rubella is also a disease that is preventable through vaccination. So make sure that your rubella vaccinations are up to date. Half of infected people have no visible symptoms, so that is something that you would want to make sure that you are vaccinated for, because you can have the infant can have vision and hearing problems, intellectual disability, or heart defects. Another specific teratogen is the mother's age. So over 35 is considered a high risk pregnancy, and that is because the mother can develop diabetes and high blood pressure at a higher rate. Teenagers are actually considered a high risk because of, for the same prematurity and low birth weight, because of the poor nutrition or medical care. They're more likely to drink, smoke, and use drugs. Gestational diabetes is very common in pregnancy, especially with older women, as well as hypertension or high blood pressure. Both of these can endanger both the fetus as well as the mother. There's also Rh disease, which means that Rh protein is found in the blood. So if the mother is Rh negative and the fetus is Rh positive, it can attack the red blood cells. So you can actually get treated very easily with that in pregnancy. I think it's at one shot. I'm not sure exactly what the treatment is, but it's very easily treated, and that is why you are tested for that in pregnancy as well. So weight gain as well is a maternal factor that can cause birth defects. So it should be around 25 pounds, and the reason is because you have a higher weight gain, you could have a higher risk of diabetes, high blood pressure, difficult birth. Stress can also be a maternal factor that causes problems with the infant as well. Depression is a high chance of depression right after the baby is born with the baby blues, and then post-traumatic stress syndrome happens a lot with um, difficult birth. But postpartum depression can also happen. But a lot of times there are mothers that are going through depression in pregnancy, and that can have a stress on the baby as well. Then there is for paternal factors. So any paternal, the father, if they have a over 40, they could cause miscarriages, autism, birth defects, uh, all sorts of different things. Men that are more likely to smoke can be a teratogen around the mother as well. And men are more likely to encounter environmental hazards, chemicals at work, which can affect the fetus in development as well.